Hello students, so we continue further our discussion on drug proving. Here in this aphorism number 137, the qualities of prover are discussed and what happens when the doses of the medicine is moderate or large. What are the consequences? So these 2 points are discussed. So we first go to the qualities of prover. So all of you know that the drug proving in homeopathy, the first aspect that he should be a human being, and second he should be a healthy prover. So we go further and we discuss the fine qualities of the prover. So the first important is lover of truth. The drug proving is carried on the experiment or on the prover. He should be lover of truth. So he is called as trustworthy. So who is lover of truth? Who is trustworthy? Second important quality, he is temperate. What is the meaning of the word temperate? That he should be a calm, reasonable person. So prover should be calm and reasonable. He should have delicate feelings. That means he should be sensitive so that he receives the impression of the medicine which is to be proved. So the first important, lover of truth. So exact sensation, exact symptom he should be able to narrate. He should be calm person and reasonable person, so that again he is giving us the exact changes which are seen in his health due to the action of medicine done in drug proving. Third important quality, he should have delicate feelings. So he should be sensitive so that he best possible way he receives the impression and gives it to the master prover. Then he can pay attention to its sensations by devoting his time. So these four qualities very important for drug proving. So in short, the prover should be lover of truth, called as trustworthy. He should be of a temperate nature. He should be calm and reasonable person, so that what are the symptoms seen in the mind, they are distinct enough so that he gives the prover, the master prover, whatever the changes which he experiences in the mental state. So if he is basically calm and reasonable prover, then he is readily will tell what are the changes in the mental state which occur due to the action of medicine. Next important, delicate feelings. So sensitive enough to receive the stimulus of the medicine which is to be proved, and hence he will be receiving the impression of the medicine and will be able to narrate whatever changes he experiences at the level of mind and body. He can pay attention to his sensations by devoting time. Okay, so he should not be having any urgent work. He should not be having any hurry to complete his own task. So he can devote the attention to his sensations by devoting time. Then he should be, then the aspect of the doses comes. So what should be the dose to be administered in a prover? What will happen if the large dose is given, and what will happen if the moderate doses are given? So to register the action of medicine, which we call as a primary action, so this is possible only when the dose of the medicine to be proved is in the moderate quantity. never large dose or never small dose. So if small dose is given, it will not have any impressions, and if large dose will be given, there will be admixture of symptoms, and hence the dose which is used during the experiment of drug proving should be moderate so that only primary effects are seen. What will happen if the large doses are used? They cause admixture of symptoms. So pure symptoms are not seen in such case where large doses are administered. Next important aspect is that primary symptoms come hurriedly and secondary symptoms are seen in the case of experiment to be done with the large doses, and the fellow physicians can't appreciate as he is not interested as he has no feelings for healing of mankind. So the fellow physicians means it is referred to the physicians of the modern medicine. They can't appreciate this, and hence often in the allopathic field or in the modern medicine field, the drugs which are administered for proving are in the large doses. So he will not appreciate the difference or the advantage of proving with the moderate dose and the disadvantage of proving with the large dose. So always remember the dose of the medicine to be administered for the experiment of drug proving should be a moderate dose and never a large dose. So why not large dose? The reasons are you do not get the pure symptoms. There is a hurriedly the primary symptoms occur and also secondary symptoms are seen, but this difference not appreciated by the physicians of modern medicine. Only homeopath can appreciate this difference, and hence he will always administer moderate doses in case of drug proving. So here we see the qualities of prover, very important, lover of truth, of a calm nature, having sensitive, delicate feelings, can pay attention to the sensations by devoting time. The most important, he should not have any urgent business so that he can pay 100% attention to the experiment of drug proving. So we go to the next aphorism, that is aphorism number 138, that is drug proving the effects of medicine. So we are going to see this aphorism where all the morbid symptoms seen on prover or changes in health which occur are solely due to the action of medicines only. They are solely due to the action of medicines only. These are the symptoms of medicines on the experimenter. So these are the symptoms of medicines you see on the prover. So whatever symptoms, whatever changes which the prover is able to narrate in the mental and physical state are always due to the action of medicine only. If the prover experienced the symptoms previously and now he again gets these symptoms, then it is considered due to the medicines only, and patient has disposition to excite such symptoms. So remember, whatever the changes in the mental state or physical state the prover experiences is always due to the action of medicine. So if he has experienced it previously a long time ago, then only it has occurred again under the influence of medicine. Plus, it shows the disposition of the patient to excite such symptoms. They are solely due to the action of medicines. No symptom can arise spontaneously on its own. So, whatever the change of mental state or physical state observed by the prover is always solely due to the action of medicine. And even if the prover has experienced this in the past, now under the influence of the medicine, he experiences same symptoms, then it shows his tendency or disposition to excite such symptoms, but they are attributed to the action of medicines only. The reason is no symptom can arise on its own. It has solely occurred because of administration of the medicine to the prover. Okay, so we go to the next aphorism. That is aphorism number 139 in the drug proving. When physician is not a prover himself, but he is a master prover. So prover should mention the changes in health, the exact sensations he experiences, and time of occurrence. Then he will narrate also the duration of symptoms. How long did he experience the symptoms? Physician takes note of all the symptoms of patient immediately after the experiment. So every time the physician will take note of all the symptoms which are seen immediately after the experiment. All the symptoms of prover. So by mistake it is written patient, but it is physician takes note of all the symptoms of prover immediately after the experiment. Physician takes note of all the minute changes in the health of the prover. Every day, physician notes the details as it's fresh in the memory of the prover. So, minute instructions are given by Dr. Hahnemann in the experiment of drug proving. Exact nature of symptoms is confirmed from the prover. Accurate details are noted down. Prover should be trustworthy. Prover should be trustworthy. You have to trust the prover's statement as the suffering humanity is at stake. So the symptoms of provers needs to be matched with the patient. Then we can accomplish our mission to cure. So what is the meaning of this? That the prover should be trustworthy. He should be able to devote his time to the experiment of drug proving. He should be sensitive. So by all these qualities, he is able to accurately note down the changes in the state of health of the prover, and because of this the accurate symptom is mentioned in the homeopathic materia medica by the master prover, and it is noted down. So the we will have to trust always on such provers, because his statement is very important as the suffering humanity is at stake, means the patients suffering from the natural diseases, if they experience this symptom, as we can trust on the prover that he has experienced the same symptom in the experiment of drug proving, then the cure is possible. So The physician will note down all the minute changes in the health of prover, who will observe the exact sensation, time of occurrence and duration of symptoms. So physician takes note of all the symptoms of patient immediately of the prover immediately after the experiment. So slight correction to be made in this symptoms of prover, third point. Okay, so and trust on the prover statement so that we accomplish the our mission to cure. Then only we can succeed in achieving cure. Okay, so so this depends on prover's accurate observations. Hence he should be sensitive and trustworthy. Okay, we go to the next aphorism. What happens if the prover is illiterate? So if the prover is illiterate, the voluntary narration of the prover is important. Nothing conjectural, that is no imaginary, no leading question should be asked to the prover. To investigate this phenomena of experiment of drug proving, symptoms of medicines are to be accurately observed. Then only cure of natural disease is possible. So we will build the materia medica by the accurately observed symptoms of the prover. So this will help in tracing the picture of the natural disease and to be matched with the effects of the medicine. So then only the similimum can cure the natural disease. So in the healthy prover, the pathogenesis is seen. Pathogenesis means the morbid symptoms the medicine produces on the health of the prover with respect to mental state as well as physical state. So what is most important in such cases of illiterate prover who cannot write down in his daybook the exact observations he has noted. So the voluntary narration of the prover is important. Okay, so we go to the 141st aphorism, the last aphorism in today's presentation. What happens when the physician is the prover himself? That is called as he is the best prover. Why? We see the reasons. Great truth that he himself has experienced these morbid alterations in the health caused by medicines, which is the curative power when matched with the natural diseases. So it is a great truth that he himself has experienced such morbid alterations in the state of health due to the action of medicine, and this same is the curative power, means the disease producing power is the disease curing power. So the symptoms of the action of medicines on the prover are noted in materia medica and they are to be matched with the symptoms of natural disease. The prover is sensitive so that he is aware of his own sensations, his mode of thinking and his disposition. So he should be of a calm, temperate nature, we saw in the previous aphorisms, so that he is readily experiences the changes in his disposition, in his mental makeup. Physician becomes good observer, more zealous, more enthusiastic. Okay, so he becomes a good observer to narrate down the changes he experiences in the state of health. The purity of symptoms is maintained surely. So as the physician, he will be a good observer, and the accuracy, the purity of the symptoms will be maintained surely. As he is a prover himself, he does not have to rely on others to understand the exact nature of symptoms. He won't deceive himself. So, very important, as the physician is a prover himself, what happens? He does not have to rely on others. There is a possibility that if the prover is not able to describe properly the symptoms, so this error cannot occur when physician himself is a prover. So he will never deceive himself, and he will accurately note down the changes he experiences in the state of health. It is not injurious at all for the state of health of the physician, but he gets the advantage. What is that advantage? That the repeated experiments of drug proving increases the resistance of physician due to these experiments, and he becomes more robust, more strong, more healthy. So this is the most important advantage Dr. Hahnemann quotes for the physician who becomes the best prover, because whatever the morbid symptoms he experiences in the experiment of drug proving will be accurately noted down, and he doesn't have to rely on others, on other provers interpretation, but he himself, being the physician, the sensitive trustworthy individual, he will record all the morbid changes occur in his state of health, and he gets the added advantage that it increases the resistance power of the physician due to the repeated experiments he undergoes, and thus the advantage is gained that he becomes more robust, more strong, and the immune power increases. So this was a discussion on the physician is the best prover. What is the advantage? That he becomes immune to various diseases due to the repeated drug proving experiments he has carried on himself. Okay, so all of you go through this discussion again and again, and we continue further the discussion on aphorisms next time. Thank you.